Welcome, friends, to Alive with Amanda. I'm excited to be here today to talk to you about your private practice needs and questions you have about being in private practice. And so today's question is what to look for in an electronic health record, EHR, EMR, however you want to say it. And so I'm going to tell you about some things that might be important for you to look at when you're selecting an electronic health record. So there's a couple things you're going to want to consider when looking into an electronic health record, and that's whether you're private pay or an insurance-based practice or a mix of both. Because if you're an insurance-based practice, you're definitely going to want an electronic health record that's going to make your life easy, especially in terms of documenting and in terms of billing. So for documenting, you want to be able to have different codes, CPT codes that you use for different sessions, and you want to make the notes customizable, whether it's an intake or whether they're follow-up sessions, if treatment plans are required, and what's required before it can be submitted through the insurance. How easy is it to submit insurance? That's like a really good question to ask. What insurances can you submit? And how is all of that integrated into one? And so if you're accepting insurance, I would definitely recommend that you look at an electronic health record where you can bill directly from there. And if for whatever reason that a particular payer doesn't allow you to do electronic submissions, that you can print out the forms that are like a CMS form, very easy for you to be able to print out. So then that way your job is easier. When using an electronic health record, you really want your life to be easier. And so you need to ask yourself if you're still doing paper records. I know a lot of private pay therapists continue to use paper records. That's okay. You're allowed to use paper records. However, you want to know, like, how can I make my life easier? How can I make it easier both on myself and my client? So one thing that makes it very easy is that I don't have to wait the 15 minutes anymore. Like I used to go up and say, here's 15 minutes for you to fill out the paperwork. The clients can already do it online. I might still tell them to come 15 minutes early so they're not late, but I'm not making sure hey, come 15 minutes before, and then I've got to print out paperwork, and then I've got to make a file, and then I've got to hold the file, and then I've got to keep that file physically for 7 years. Kind of gets to be a lot, especially if you're in practice for a long time. 7 years, that could be quite a bit of files that you have to physically handle. I remember at one point, I needed to get a storage unit for these physical files that I had. And that's, another expense, which is fine. But if you want to make your life easy, having an electronic health record, one that obviously stores all of your clients' files there. You can keep that for 7 years. They can fill out the paperwork online. You can take payments and directly reconcile right in the file, so then you don't have to make sure you're running credit cards at the end of the night, or you're running credit cards with your clients. It allows for an easier process. And so if you're trying to make your life easier, you definitely want to be looking into some electronic health records that are going to do that for you. So I want to take a moment to thank our sponsor, TherapyNotes. If you don't know, they are an electronic health record. They offer one, and it's fabulous. It does a lot of the things that I just talked about, which is why my group practice uses it. So at the second half of this talk, we'll talk about group practices and what to look for if you are running a group practice, or even if you're just a part of a group practice. And so a special shout out again to TherapyNotes. They are awesome. So be sure to check them out. So if you're an individual, a solo practice individual person, your needs may be different than somebody who's in a group practice. In a group practice, you want to be able to, if you're the owner, you want to be able to appropriately monitor what everybody is doing, check and see if payments were made in a very easy way, do the billing, be able to review what you need to review. And so you want to know what the functionality for a group practice is. So here's what I'm going to warn everybody. Even if you're not thinking about doing a group practice, you never know what's going to happen down the road. So I would say that to be on the safe side, ask about some of the functions that come with a group practice, whether they charge per client, whether they charge per person, do you get a discounted rate per person? Those are really important things to ask yourself, because if you're a small boutique practice, being charged by the client might not be that big of a problem. problem. But if you're running like a larger group practice that sees lots and lots of clients every month, if you're charged by the client, it might be pretty expensive. And so you want to be able to weigh out those things. So I would say, if you're in a group practice, you find out how easy is it for me to track payments? How easy is it for my clinicians to take payments, for me to reconcile that their payments are taken? Again, with the billing piece, can I set everybody up appropriately? Can I submit different kinds of claims? Because those of us who have group practices know, like, some are under a group policy, some are under a group panel, some are individually paneled. Am I able to easily maneuver around those things? So there's a couple of things that you're going to want to consider. So one cool thing about TherapyNotes is that they'll give you 2 months a free trial. If you use the code Amanda, if you're a member of my private practice tribe, because they want you to try it out, I would definitely recommend trying them out and trying out. If you're even interested in looking at some of the functions of other electronic health records, you want to ultimately find one that's going to work for you and have your needs met and make your life simple. I'm all about making my life simple, and I want your life to be simple. So be sure to take a look at all the functions you need for your practice, and happy hunting.